WHBC and WHBC.com.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. This morning, I'm joined by Brad White, compounding pharmacist and vice president of Medicine Center Pharmacy, and our special guest, Dr. Ramaiah, gynecologist and robotic surgeon at Total Women's Care. Good morning, Dr. Ramaiah, and welcome.
Good morning. How are you, Paul? Good morning, Brad.
Good morning. Okay, studies show that somewhere between 25% and 45% of postmenopausal women find sex painful. Estrogen, the primary female sex hormone, regulates your reproductive system. Before menopause, estrogen helps maintain the thickness and elasticity of your vaginal tissues. However, as you age, your estrogen levels drop, causing changes in these tissues. When vaginal tissue grows too thin, sexual activity can become painful. Our topic today is women's health with a focus on the Mona Lisa Touch, a promising and exciting hormone-free treatment. We'd like to remind our listeners that today's program is going to be available on our podcast. You can find that in the App Store on your smartphone. Just search for Health Matters with the Medicine Center Pharmacy, and you can subscribe and download our programs.
So, Doctor, please introduce yourself again. You've been on the show before, and tell us about your practice.
Yes. We at Total Women's Care have been providing women's health services for over 2 decades now. I trained and did my OBGYN residency at Altman Hospital and then decided to stay on in the area. I've since gotten married and raised a family as well. Now, over the last few years, I've been focusing mainly on GYN care. I also teach residents and medical students at Altman Hospital. I'm a clinical associate professor at the local medical school, and I practice both out of Altman Hospital and Mercy Medical Center.
So what's different about the way you practice medicine?
Excellent question, Paul. So we pride ourselves in the care for women by women. We provide customized medical care, which is cutting edge, compassionate, and comprehensive. Each one that comes in to our office is treated like an individual that is different from the rest, and they're considered part of the team where we, along with the patient, focus on providing not just treatments, but also, preventive care, which I feel is kind of lost in the struggle now, where modern medicine has become more about treating illnesses versus preventing. And so a lot of my focus is also on actually maintaining or preventing disease, in addition to treating disease.
So what is alternative medicine, and how do you incorporate that into the practice?
Surely. So, Paul, as you know, I grew up in India. And so, I was raised around a lot of natural health remedies, Ayurvedic medicine, yoga, etc. And, that all went by the wayside when I started medical school and then residency, etc. But after years of practicing, I realized there was something missing about allopathic medicine, which is what I trained to be proficient in. And so I went looking for answers, especially for chronic conditions, a lot of women's health issues. Not everything is treated by giving you a prescription, So I went around and did some research. And so now I feel that in my practice, I use a combination of allopathic medicine as well as alternative or herbal medicine. And there's a little dash of Ayurveda in there as well. So, we kind of focus on, okay, what is the best way to provide solutions for individual issues for that particular person.
You know, we've gone through a period, and maybe we're still in the period, I don't know, in healthcare where when you go to a doctor, you expect a prescription, okay? Or give me this, or give me an antibiotic because I have a cold, you know, something
Exactly.
like that. So how does your patient base,
I'm sorry?
how does your patient base look at this? Well, I'm not, you know, you don't need a prescription.
No, fortunately, I think women are very, very open to this. And a lot of them come in because I'm not giving them a prescription right out at the outset. Don't get me wrong, you know, prescriptions, allopathic medicines have their role. And I do think that we cannot ignore their importance. But I feel like a lot of times we forget about the simple things we can do without resorting to those prescriptions right at the outset.
Sure.
I understand that you are a bioidentical hormone therapy specialist. Can you explain that to our listeners?
So, you know, in keeping with this idea that Paul brought up, you know, give me a prescription kind of culture, I think we have to realize also that not everybody falls into one peg. You know, there's so many different options, choices available, that I think we, in allopathic medicine, we forget that there is an individual behind that. And so I think that we always have to keep our options open and saying, okay, what works best for this person? And unfortunately, there's only so many choices available in terms of prescriptions for hormones. And so, you know, thanks to practitioners like yourself, Brad, you know, it's been very, very helpful where we can reach out to our pharmacist colleagues and say, you know what, the traditional allopathic prescriptions are not working for so-and-so. What options do we have? And fortunately, you can provide us those individual customized solutions for the different hormones, be it estrogen, testosterone, you know, what have you. And I think that being in the field with you, I think together, it's a great win-win combination.
Yeah, for our listeners that maybe don't understand what a compounded medication is or a customized solution, you know, it's not unlike other solutions you might have from maybe custom windows put in your house because all the window openings are different. It's you know, you can get many FDA approved medications in custom dosage forms. So for example, like Dr. Ramaiah mentioned, maybe the 10 milligram tablet that big box manufacturer makes is too much for you. Or maybe it needs to be 11.25 milligrams. Rather than you having to break tablets and take quarters of tablets and things like that, we can prepare a capsule or a tablet or a lozenge or a number of different dosage forms to help you get that custom dose your doctor feels you need. We can provide a variety of services for patients across the spectrum, from people to even pets. It's not uncommon for us to help patients at like the Children's Hospital who have seizure disorders and can't swallow tablets and they need a suspension. And it's, you know, we can make a lot of interesting dosage forms to help patients, whether they are 2 years old or 102 years old. So it is very helpful to be able to customize those doses. We're proud to be one of the first 2 accredited, nationally accredited compounding pharmacies in the state of Ohio. And it helps us keep us on our toes to not only prepare high quality products, but we have a lot of quality control that goes into that process, so you can have confidence that working with your physician, the 3 of us, between the patient and the pharmacy and the provider, we can help you find a solution that can really help solve your problem if you've tried things that just don't seem to meet that need. So doctor, how do you, you know, you kind of touched on it. Are there any other things that you like to use custom dosage forms or custom compounded medications for to help patients that just can't be met commercially?
I think that you've raised a very important issue for patients, and it's not just with hormone therapy. I'm talking about other medications, especially pain medications or neuropathic medications. And I think it's important to work very closely with your compounding pharmacist, who is knowledgeable and can provide very, very important information to keep the patient safe. And in fact, most people that know about bioidentical hormone therapy, which is basically estrogen, progesterone, testosterone, cortisol, etc. But I also use different compounded medications for chronic vulvitis, for bladder incontinence, for recurrent herpes. Numerous things can be used where you don't have to utilize oral therapy or formulated allopathic therapies, which can have their own side effects. And so, like Brad mentioned, we can actually cater it or fine tune it to your individual needs, where I can get a combination of some local anesthetic medication along with a pain medication along with a nerve modulating medication, which you can put locally in the area that's affected and eliminate it almost completely all the systemic side effects. So I think it's a win-win.
I think so too, and I do want to kind of take a political jab here, if you don't mind, because for the women listening that benefit from bioidentical hormones, or for any patient who's listening today that wants to be able to have their provider help them with any solution out there, it's important that you know that bioidentical hormone therapy is under attack by the FDA. And right this moment, there are documents on the table that if the FDA passes, every woman and man in this country will lose the benefit of being able to have those customized compounded therapies. So just, I encourage you to remind your elected officials who they work for. They work for you. So it's important that you share your views with your providers and your politicians, because every patient should have a right to access healthcare in the fashion that is best suited to treat them. So please keep that in mind. It's very important. If you have questions, please contact me at the pharmacy or hit up our website for info, and I can share that info. But there's some pretty, there's powerful lobbyist groups in Washington, and unfortunately, self-interest groups are running amok. So carry on, Doctor. I'm sorry.
Unfortunately, I think that compounding has fallen out of grace, mainly because there are people that are utilizing it as additional sources of revenue versus actually understanding the pros and the cons and the risks and the benefits and using it appropriately in appropriate situations and the appropriate amounts. And I think that's where going to somebody that's knowledgeable, be it a pharmacist or be it a physician, I think that's important in using these medications judiciously. I've had numerous patients that have come to me from other providers because they've are having side effects from these hormones being prescribed just ubiquitously or without any real understanding of the basis and how to use it safely. And I think that's where the FDA kind of came in and said, well, what's going on here, And unfortunately, as pharmacists and physicians, we need to be more aware and vigilant on making sure you're using these appropriately. It's kind of like playing with fire. You really need to use it wisely.
You do, and unfortunately it is a case where a few bad apples are really spoiling it for the bunch. So.
Right. Okay, Doctor, we're going to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy. I like your backdrop, by the way. Are you in your garden?
I'm in Hawaii. No. You need something different,
Hey, that would surprise me with all this electronic stuff. So. Not a bit. So
I went looking for different backdrops last night, and I'm like, oh, this looks nice.
That's cool.
Cough drops and maybe a humidifier, and make sure you take a good multivitamin like Linus Pauling Super Multivitamins.
Back in 10, we'll have about 6 minutes in this segment.
And make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Ramaiah, gynecologist and robotic surgeon from Total Women's Care. You have one more question, right, Brad? No.
No, I think we're ready to talk about the Mona Lisa touch.
Okay, let's do it. Tell us about it, Doctor.
So I'm really excited about this novel procedure, which even though it's been around now for about 8-9 years, it's still not very familiar amongst the lay public. And I'm really excited to talk about it because I think it's one of the it's a game changer is what I would call it, for lack of a better word. It's basically an in-office, hormone-free, chemical-free procedure. It takes about 5 minutes a session that helps increase the vulvovaginal, and lower bladder elasticity that is lost because of menopause, as Brad was talking about earlier. And it's especially useful for women who cannot use hormones or choose not to use hormones. This is an excellent alternative.
So, what is the history of Mona Lisa touch, and what are the benefits?
It's interesting. About 10 years ago, a couple of gynecologists in Italy actually thought about this and set about trying to figure out how to use it. And at that time, it was still in its nascency. Nobody knew about the safety, efficacy, etc. But they realized this was working really well. So they reached out to a nationally renowned urogynecologist in Canton, actually in Ohio, Dr. Mickey Karam. And Dr. Karam was intrigued enough that he actually flew over to Italy, stayed there a couple of months, tried to gather more information about this. And of course, in the US, we always look for scientific data, and we just don't, do something just because. So he came back here and he set about creating some of the most elegant clinical trials. He joined forces with another physician out on the West Coast, and they went about actually figuring out what is the most appropriate, way to do this in terms of the power, watts. Laser machines are not, it's not like child's play. And so they went about strategizing and figuring out what would be the safest way to use this with the maximum benefit. And so they've actually standardized this right now. And I had the good fortune to actually go and train with Dr. Karam, and it's just, I cannot explain how unbelievably amazing the results are. And until Mona Lisa touch, especially for my younger breast cancer patients, I did not have anything else to offer them, and they were basically cripples. And so with this, it's been quite life-changing, literally, for myself as well as for patients, because now I have something I can offer them. And this Mona Lisa touch is a laser procedure. It's actually a medical procedure. This is not a plastic surgery. And the FDA has mandated that this machine be sold only to gynecologists so that it is not misused and converted into a plastic procedure. This is a medical procedure filling a very, very, very important need.
So how many physicians are doing this?
So in this area, there are probably a couple of them doing it, but the problem is I don't think there's enough education out there. There's enough information that is being imparted. There's so much information about breast cancer treatments, Viagra, but not too much about this procedure, especially because it impacts women so powerfully. I think there is a little bit of a gender bias there, if you will, but I won't get on my soapbox. But I think that it's fulfilling a very, very important void.
Would you say that America is first in women's health, or is there another country or other countries in the world that are more progressive than we are?
I think that we are pretty cutting edge when it comes to medical treatments. I think, though, in terms of alternative or para-allopathic treatments, I think we are a step behind compared to our European colleagues. I think there is not as much, how should I say, restrictions, I would say. Our FDA is, and they have their reasons for being more circumspect, for being more careful. But I think there's a lot of politics that goes in there with the FDA as well. So I think we're a step behind in terms of alternative or newer therapies, if you will, compared to Europe.
So getting back to Mona Lisa, who's candidate for this?
Very good question. Any condition that makes the vulvovaginal lower bladder, the vulva tissue more irritable, more dry, more sensitive, may be an appropriate candidate. And it's not just people who are perimenopausal or menopausal, but also women who are lactating, breastfeeding, and they have some vaginal dryness because of that. And this is really, it's a no-brainer in my mind because of its safety profile. Things that this can help treat is not just pain with sexual intercourse, but also chronic vulvitis, chronic irritation, chronic itching, burning, and even low grades of incontinence, where the people feel like they have constant bladder infections, but they really don't. It's just the dryness that's causing that irritation. It's an excellent procedure. In fact, I've had a couple of people that have come in and have had this done just for the bladder symptoms, even if they're not needing it for sexual activity. So I think that the indications have expanded as we have found out how beneficial it is to the surrounding areas locally in the pelvis as well.
Okay, doctor, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy. Your hosts.
Severe Weather Station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Not as warm. Should be a very nice day. Sun, patchy clouds today, high 75. For tonight, partly cloudy, low 60. Clouds and warm, passing shower tomorrow, the high near 81. Clouds warm and humid. Evening thunderstorm for tomorrow night. That'll be followed by some rain and a thunderstorm, low 68. Clouds warm and humid. Thunderstorm on Sunday, the high 78. I'm Steve Williams for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
We are back to Health Matters with the Medicine Center Pharmacy. Today, Brad and I are discussing bioidentical hormone therapy. We have Dr. Ramaiah with us from Total Women's Care. So, what kind of success are your patients receiving from this Mona Lisa therapy?
So
I like the name because Mona Lisa. Obviously, it came from.
I think it's very, very clever. Very good choice. So I've had probably about 80 to 90% success in treating not just vulvovaginal atrophy and pain with intimacy, but also for chronic vulvar conditions like lichen sclerosis, chronic vulvitis, low levels of incontinence, some degree of even prolapse has this, it just basically tightens all this tissue. So it really does provide a significant improvement. It will not anatomically correct it, but it will make it less symptomatic. My youngest patient was probably about 42 because she had to have everything taken out for a medical reason. And my oldest, actually, I'm proud to report, is 83 years old and has had significant benefit and is very happy. So all in all, I think we have to individualize and make sure that we're not missing other issues that are masquerading. And those issues will not be corrected by Mona Lisa Touch. And I think that's important. It's critically important to make sure you know what you're addressing and what you're treating.
What about downside risks?
I think, like I mentioned, it's important to figure out, are there any contraindications? There are very few contraindications, but definitely I think we offer a no obligation free consultation, and you don't have to change your gynecologist to come. You can come in for the procedure and we'll send all the reports back to your gynecologist or your primary care physician. But I do want to make sure that we are treating the right condition. A couple of people came in and they actually had other issues that would not have helped them with the Mona Lisa. So I really want to make sure, stress that we educate and understand what we're treating and whether this will treat it or not. I think the biggest downside is that this is not covered by insurances, health insurances. Unfortunately, Cialis and Viagra are covered, but this is not, and this is probably another thing that we probably need to lobby about. But at this point, it's not covered. However, it can be utilized, it can be paid under your HSA or flex plan. And so it can be deducted as a pre-tax benefit. The other downside, I think, is the lookalikes. You know, we talked earlier about this being a medical procedure, not a plastic procedure. So there are a lot of other physicians in the area that are using or converting their aesthetic plastic surgery laser machines, converting it and using it for this, which does not last. And I think it's giving Mona Lisa Touch a bad rap, because I have had patients come back and say, well, I had it done, it's not working, it's not good. Well, you didn't get the real deal. And that, I think, is another big downside. So basically go to somebody that is doing Mona Lisa Touch. Do not use all the lookalikes that say they work, but they're not permanent. And also go to somebody that has done this before. Ask them, how many have you done of this before? What is your success rate? What is your comfort level? And I think it's important to do for patients to do that due diligence and figure out, okay, who am I most comfortable with, what's going on, and then proceed with the procedure. I think it's a win-win and literally a game changer.
Would you say that the laser device for this treatment is unique in structure, size, I don't know, whatever?
Definitely. It is one of a kind, and there may be other laser machines that are similar, but this one has been customized and made specifically for this, to let you know this is not being used for anything else. It's not being used to tighten the face. It's not being used to do liposuction. This is a one-stop, it's only made for this one thing. And I think that's where it has its edge.
Interesting.
So it might be a good time to ask this question. Based on what you just said a little bit ago, you can, patients that are interested in learning more can contact you directly at your office at Total Women's Care, or it sounds like you can get referrals from other OBGYNs.
Definitely.
Okay.
And, there's information out there. YouTube, of course, Dr. Google, Dr. Yahoo. Just go and Google Mona Lisa Touch, or you're welcome to call my office, 330-452-9900. We can get you in for a free, no obligation, no pressure consultation. Because before I do this procedure, I need to make sure that you are going to get the benefit. I don't want to just pull you off the street and do it without really being able to guarantee that, yeah, this is going to help you.
Okay, good to know. How about this? What would you say are some exciting developments in your field?
So for the longest time, we really didn't have anything after the forceps, after cesarean sections, safe anesthetic procedures, etc. I think the two most exciting things that I can think about in GYN is one, of course, is the Mona Lisa Touch, but also the Da Vinci robotic surgery, which has really revolutionized and brought forth newer minimally invasive surgeries where patients can return to their normal lifestyle very, very rapidly.
So what are some of the benefits of robotic surgery compared to traditional surgery?
The big thing is the downtime is so much reduced. There is not the same degree of discomfort and pain post-procedure. These, I'd say, are the two biggest pluses. And I'm proof of this because I had I've had surgeries both ways. You know, I've had laparotomy, which is the traditional cesarean section incision, and I've also had robotic surgery. And I have to say there is a world of difference. To give you an idea, after my robotic surgery, I was able to return to work within a week. And I don't recall even using any narcotic pain medications. So it was just revolutionary and totally mind-blowing. So I stand behind you as proof of that.
Where are we
Who are
going?
some of the
Where
best?
where are we going with robotic surgery? Is it continuing to improve or advance or I don't know exactly how to ask this, but
So yeah, that's a good question, Paul, because I think that with the advances in technology in terms of the computer robotics, in terms of the fiber optics and the cameras, light sources and the camera pictures are improving so rapidly, even since the onset. So I've been doing robotic surgery since 2009. And even since then, we are on our third system of the robotics machine, because the company has been innovating, trying to improve their ancillaries, as well as the instruments have also improved significantly.
where did this originally come from, robotic surgery? What country?
So I think originally it was in Canada, and then it was brought into the US. Intuitive Surgical is the company, and they are the pioneers. Since then, there have been a couple of other companies that have tried to enter the market, but I think Intuitive Surgical is head and shoulders above everybody else, just because of the length of time that they've put in here.
I know the robotic units are extremely expensive, and then I heard one of the hospitals was wishing for another one, and it's just too much money.
Yes, this is true. Unfortunately, the cost for the machine, the initial cost for the machine is quite significant. But I think over the long term, hospitals will reap that benefit in the shortened post-op time and the quicker recovery, so we can get patients home sooner. So I think that's where the benefit lies.
How long did your training take to become a robotic surgeon, if you will?
Good question. So this was back in 2008. The company at that time was just starting out, trying to train physicians, and the learning curve is a little bit steep, I have to admit. And so we actually had a couple of days of an animal lab. So we went to this animal lab, and we actually worked on a couple of animals, trying to figure out how the system works, learning the physics behind it, and then also learning the optics. So basically learning the background, the physics, and then actually doing the procedure itself. So that was a couple of days. And then we had a series of didactics online where we went through a series of lectures. And then there was actually certificate courses that we had to take in order to provide proof that we were trained. After that, we also had what are called proctors. So we picked patients, our own patients, of course, with full informed consent. And for, I think, about 5 or 10 cases, we had proctors that actually came from all over the country to watch us and to critique us, to make sure that we were proficient enough before we got a full credentialing at the hospitals. And after that, there's ongoing training as well, where you have to do a certain number of cases every year in order to maintain your proficiency. And so there's a lot of checks and balances built in. Every hospital also has their QI committee, quality improvement, where we look at cases, we look at outliers, what's going on, how this is working, so we can try to police ourselves and keep ourselves safe along with our patients.
Okay, folks, break time is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, 6.5
time with instructions clearly labeled. It's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. We're talking with Dr. Ramaiah from Total Women's Care.
All right, doctor, let's, we've talked about a lot of stuff today. We've talked about the Mona Lisa touch. We've talked about bioidentical hormones. We've talked about alternative methods for women's healthcare. How do patients that are listening today get more information about you and your practice?
There are a couple of different ways. Actually, even if you, let me give you my website. It's www.R for Robert, A, M for Mary, A, I, A, H for Harry, GYN.com, RamaiahGYN.com. And our office number is 330-452-9900. We have a bunch of wonderful girls, staff working for us that are part of our team. And I know that we would welcome you as a patient. However, I want you to know that you have options, you have choices. And an informed person is one that will get the best service. And make sure you don't settle for somebody that just throws medicines at you, somebody that listens to you, somebody that understands you, somebody that wants to help you in a way that's suitable for you. I think that would be the important thing. In this day and age, we don't have to settle. So if your physician is not listening to you, then go find someone that is listening to you. We do offer a lot of other services. I think though we pride ourselves in providing customized, compassionate, and comprehensive care. So again, that number is 330-452-9900. And we welcome you as a patient, or even if you wanted to come in for a consultation for the Mona Lisa touch, you do not have to change your gynecologist at all.
Okay, very good. Can you touch on, at one of our commercial breaks, we were talking about how the COVID pandemic has really changed how people take care of their regular routine healthcare services. Can you touch on best practices for women in general on what they should be thinking about on an annual basis to make sure they're in the best of health?
Surely, Brad. I think at the outset, one has to make sure that we are exercising precautions. COVID is here to stay. I do not think that we are ever going to have a time where we can say, oh, now we don't have to, we can drop our guard down. Social distancing, wearing a mask, appropriate hand hygiene. These, I think, are the three very important things that we have to be vigilant about. Having said that, we cannot also allow COVID to hold us hostage and end up being prisoners in our own homes. So I think we have to exercise precaution, but at the same time, we have to balance out and make sure that we are getting the appropriate care that we need. Oftentimes we spend more time taking care of our cars better than we do our own bodies. And so I think that we have to be vigilant and know what needs to be done, what needs to be taken care of, what preventive maintenance is required for our bodies.
How often should a woman get an annual physical?
So an annual physical with the GYN exam, I think, is important for every woman, as long as she is, she has her female organs, as long as she has her breasts. A lot of physicians, and you don't have to come to a gynecologist. If your internal medicine doctor, if your family physician is able to do this service, offer this service for you, I think that's perfectly fine as well. However, just as a gynecologist cannot take care of your heart, even though they know about the heart, the fine nuances are better off being taken care of by a cardiologist. Similarly, I do believe that the nuances of women's health is better addressed by a gynecologist.
Okay, very good. What's the current recommendations for mammograms and PAPs?
Excellent question. The mammograms are recommended after the age of 40 annually. And there's some societies will say, some medical societies will say no more after age 80, but I think that's an individual decision based on the person, what her lifestyle is, what is her quality of life, etc. For PAPs, they have relaxed the rules, and the earliest is age 21. Before it was age 18, now it's age 21. And then 3 to 5 years thereafter based on the risk profile.
Okay. What's what are you most excited for on the horizon?
I think what I'm really happy about is that women have so much power in their hands now. You know, you don't have to settle. You don't have to follow what your grandmother and your mother did. And I think women have to take matters into their own hands in order for them to live their best life, both physically as well as mentally and emotionally. And it's a great time for us to take matters into our own hands.
Well, I do think we need to demand more of our healthcare practitioners and our politicians, as we talked earlier. But, you know, I think it's important that you ask questions and try to make sure that you're well informed. Like you said, there's a lot of information on Dr. Google, but you also have to understand that sometimes that information may be tainted in a way that you need to trust but verify. So don't be afraid to ask your provider questions and make sure you seek out multiple perspectives to get a nice depth of information. So how about you give your website and your phone number one more time before we wrap up the program?
So the phone number is 330-452-9900, 330-452-9900. And our website is www.ramaiahgyn.com, RAMAIAHGYN.com.
Okay. Anything else real quick?
No, I do want to thank you guys for your service to our community for so many years. And it's, you know, I'm privileged to be able to work with you both. And I know that when I turn to you for compounding medicines, I know that you're doing right by our patients. Thank you for your service.
Appreciate that very much. Thank you very much.
Thank you.
Thank you again to our guest, Dr. Ramaiah, gynecologist and robotic surgeon from Total Women's Care. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at MedShop RX.